Hi everyone, I hope I am clearly audible.
Yeah,
Yes.
I am able to
Yeah,
hear you. I'm
okay.
Govind Hari.
Yes, thank you for joining
Yeah,
in.
I'm Govind Hari.
Yes, sir.
Sir, namaskar. Welcome.
Good afternoon, Dr. Rana. This is Rangareddy here.
Hello, sir. Rangareddy sir. How are you?
Yeah, Rangareddy here.
Very
Namaskaram.
good
Welcome.
afternoon.
I think a lot of people have to join yet, right?
Yes, joining and yeah, they are joining.
So
We
we would be waiting for a couple of minutes for
can start at
allowing,
14:05,
yeah, we can start after 5 minutes.
2 minutes, after 2 minutes maybe.
Okay, so we'll start after 2 minutes.
The voice is breaking. I don't know whether you are able to hear properly. Here it is. Voice is breaking. Can you check?
Sir, I can hear you now.
Yes, sir, we can hear you.
Ranaji,
आपकी
once you
आवाज
say yes, we will start.
Last.
I think we can start, sir. It's fine. No, you are muted.
So, hello everyone. I'm Dr. Saroj Singh, serving Assistant General Manager at the Quality and Accreditation Institute. It's my pleasure to extend a warm welcome to each one of you to this international webinar on World Hand Hygiene Day 2024, organized by the Quality and Accreditation Institute, which is an emerging international accreditation body with its origin in India. WHHD is celebrated every year on 5th May with a unique theme and slogan, The WHO theme for this year is promoting knowledge and capacity building of health and care workers through innovative and impactful training and education on infection prevention and control, including hand hygiene. And the slogan for this year is, why is sharing knowledge about hand hygiene still so important? Because it helps to stop the spread of harmful germs in healthcare. We would be unfolding various aspects of it going forward in the webinar today. So in resonance with the World Health Organization's campaign for World Hand Hygiene Day, we have orchestrated this webinar along with a contest, inviting participants to showcase their ingenuity, making hand hygiene more enjoyable, entertaining, and engaging. We are delighted to announce that the response to our call has been overwhelming. I extend my heartfelt gratitude to all participants. Shortly, we will unveil the winners, affording them the opportunity to present their creative endeavors in today's webinar. I'm happy to share that we are honored to have a diverse panel of experts among us today. Firstly, I extend a warm welcome to our esteemed chief guest, Sri R. Govind Hari sir, the founder and chairman of Pushpagiri Vitruretina Institute, Secunderabad, and chairman of PRASHO, Pragyan Sustainable Health Outcomes. He is also the advisor. Welcome, sir. Yeah, so he is also the advisor to Dr. YSR Arogyashri Healthcare Trust, Government of Andhra Pradesh, founder of AHPI, advisor to ANBAI, Association of National Board of Accredited Institutes, Telangana, and AP chapter, General Secretary to TSHA, Telangana Specialty Hospital Association. He is a developmental strategist, social entrepreneur, promoter of Indian culture, and a mentor. Sir, your presence adds great value to our gathering. Thank you for joining us today. Additionally, I also welcome our special guest, Dr. Ranga Reddy Burisa, the founder and president of the Infection Control Academy of India and the vice chairman of PRASHO. Moreover, it's a privilege to have Dr. B.K. Rana, CEO of the Quality and Accreditation Institute with us. Dr. Rana's extensive experience and contribution to healthcare quality and accreditation, both nationally and internationally, are truly commendable. Our distinguished speakers for today's webinar include Mr. Anirudh Bruman, who has joined us from Netherlands. He's an infection preventionist and international assessor of patient safety standards. Then we have with us Dr. Aditi Jindal, senior consultant and head of biochemistry at Rajiv Gandhi Cancer Hospital and Research Center, Delhi. And Dr. Anubhav Pandey, he is head of clinical labs at Amrita Hospital, Faridabad. Thank you for joining us today. Warm and heartiest welcome to all of you. And last but certainly not the least, I extend my heartfelt appreciation to all the participants. It's your involvement that makes event like this truly special. So to commence our webinar, I kindly request our CEO, Dr. B.K. Rana, sir, to deliver his opening remarks and welcome address. Over to you, sir.
Thank you, Dr. Saroj. Thank you very much for your kind introduction. And I, on behalf of QAI board, welcome R. Govind Hari Garu sir, Dr. Rangareddy Garu sir, and all our esteemed speakers, all delegates and winners. Thank you very much for joining this webinar. And we truly appreciate your contribution to the world of healthcare in providing safer care to the patients. And today, this webinar is actually committed towards clean care, safe care, hand hygiene, infection prevention and control activities, and so much and so forth on the occasion of World Hand Hygiene Day, which is celebrated globally every year on 5th of May. So we are actually too much honored to have too much of extreme knowledgeable panel. And I would say that most importantly, all the participants who have really committed towards clean care, infection prevention, and their commitment to participate into practice, which you would see after some time how they have really demonstrated their commitment to practice of clean care. And therefore, it is very important for all us of in healthcare delivery system that we all labor, whether it is a management, leadership, it's managerial, supervisor, or ground level healthcare workers. For everyone, each and everyone has to contribute. I always say in such type of activities that the most important person in a healthcare facility, in order to make sure that infection is not spreading and your prevention and control protocols in place, is your housekeeping staff. If your housekeeping staff is not doing the job as he or she should do, whatever you do, you may not achieve the desired outcomes for infection prevention and control. And therefore, we have to empower our housekeeping staff. We have to trust and leverage the knowledge with us to share with them that what important role they play in preventing infections across the healthcare organizations. So we are really honored to be part of such global campaign at QAI with the support of all our participants, attendees, and our chief guest, Govind Hari sir, our special guest, Ranga Reddy sir, and our three distinguished speakers. One of my friend, Dr. Annie, comes from Netherlands, an expert in infection prevention and control. Aditi, seasoned biochemist, very seasonal professional, and also Anubha Pandey, a microbiologist with Amrita. I think you will really cherish their deliberations. And I won't take much time in these. We'll wait for the more technical sessions to come up. So with this, I thank you once again, every one of you, and give the floor back to Dr. Saroj. Thank you.
Thank you so much, sir, for your motivational opening remarks. Then now it's time to invite our special guest, Dr. Ranga Reddy sir. He is the founder and president of Infection Control Academy of India, honorary professor at School of Medical Sciences, University of Hyderabad, chief editor of Infection Control Trends. He is a physician, public health activist, educator, philanthropist, and social entrepreneur with interest in business verticals of high social impact. He is focused on public health awareness, education, and training. He is committed to improvement of infection prevention practices and patient safety in India and other low-resource settings. He is the course founder and coordinator for postgraduate diploma in infection prevention and control. We welcome you, sir. Sir, requesting you to kindly address the gathering.
Thank you very much, Doctor, for that really higher than life-size kind of introduction. Thank you very much. Respected colleagues, my heartfelt greetings to all of you on the occasion of World Hand Hygiene Day 2024. My special compliments to QAI for its exceptional efforts to organize this session and also pioneering the quality initiatives within the healthcare sector. Your invaluable work is pivotal in elevating patient safety standards, not only in India, but also on a global scale. My sincere thanks and appreciation to Dr. Rana and the entire team of QAI for the privilege which you have bestowed upon me to participate in this esteemed session, which certainly is going to make a difference on how we are going to make a difference to the patient safety on a global scale. Next few minutes, I would like to discuss the topic of hand hygiene, its significance in the context of contemporary healthcare systems, the burden of healthcare-associated infections, and antimicrobial resistance. And of course, I would also be touching upon the hurdles and obstacles in enhancing the hand hygiene. And of course, we will also be briefly talking about the goals to boost hand hygiene adherence or the compliance. While some of the things, which I am going to touch upon may look like, very routine, and in fact, they would be routine, but on such an occasion, like World Hand Hygiene Day, I think it is crucial to emphasize the aspects which are related to the hand hygiene, which is a prime driver to reduce the healthcare associated infections and making patient safety a kind of central to the modern medicine. It's certainly a common knowledge that the hand hygiene is a straightforward and the most efficient way to clean our hands and considerably diminish the presence of potential pathogens. As you all know, that when we talk about the hand hygiene, it encompasses the whole lot of procedures like surgical hand hygiene, the antisepsis, the use of alcohol hand rubs, the regular hand hygiene and regular hand washing, and also the antiseptic hand washing. All this is the encompassed within the word called as hand hygiene when it comes to the healthcare systems. But at the same time, there is always little confusion even among the specialists why there are 2 days which are celebrated in the world for the hygiene related to the hand. As you all know that on October 15th of every year, we also celebrate a global hand washing day, right? And on May 5th, which is tomorrow, we will be celebrating a hand hygiene day, So we need to distinguish between that. When we talk about the global hand washing day, it is mostly related to the community level efforts in order to bring the hygiene and also reduce the rate of infections and also other, kind of morbidities which are related to lack of hand hygiene. But when we talk about the hand hygiene, right, which is going to be celebrated tomorrow, it is all about the hand hygiene, as I said, all the aspects of the hand hygiene, which is having its impact and also, which had to be done within the healthcare system, that is our hospitals, nursing homes, etc., etc. So that's why it is very, very important, I thought, to bring out this so that, we clearly demarcate these 2 things and certainly make a difference to our practices. So going a little into the history of how the hand hygiene as a practice has started, and the year 1847 has really been a significant milestone in this global movement, which is called as hand hygiene movement. Professor Ignal Semmelweis has made a pioneering effort to bring scientific evidence to change practices in clinical settings. He was a well-known doctor and an obstetrician who has made a groundbreaking work on antiseptic procedures and postpartum infections, which has earned him a title which is very apt, that is savior of mothers. Despite of his logical findings backed by strong evidence, widespread acceptance of the hand hygiene came only years after his death, which was very unfortunate. This acceptance was facilitated when Louis Pasteur and others have built further on the foundations which was laid by Dr. Ignaz Semmelweis. And as you all know that Louis Pasteur has confirmed the germ theory, which has provided a theoretical explanation for Semmelweis' observations. And taking on that, Joseph Lister has done a lot of research, practiced and operated using hygienic methods with great success, reducing significantly the healthcare associated infections, not only the morbidity related to that, even the mortality. Subsequent efforts by the giants like Florence Nightingale. I'm sure today there must be a lot of nurses here who take her as a role model and an inspiration to do a lot of things in terms of providing quality and safe care, right? She has built on this foundation, heightening the awareness and also improving hand hygiene practices in her own way. But another pivotal moment has happened from 1960 onwards, when these efforts, which I talked about, were redoubled with the introduction of evidence-based guidelines from organizations such as US Public Health Service, the CDC, the EPIC, HICPAC, WHO, SHIA, IDSA, ICMR, NCDC, etc., etc. Unfortunately, despite the plethora of all these guidelines, what I have mentioned, and also the evidence, it is crucial to ask today, especially on the day when we are celebrating this World Hand Hygiene Day, we had to ask probably ourselves, why sharing knowledge about hand hygiene remains so important, and why we should continue to build evidence for its importance. To my mind, the reason why we had to keep talking about hand hygiene, spreading the knowledge and talking about it is that the importance of hand hygiene in preventing diseases and promoting healthier communities is undeniable. But at the same time, we also see that there is a lot of resistance to this simple procedure even today. This resistance among the healthcare workers and also all those people who work within the healthcare system results in approximately 500,000 healthcare associated infections a day, which amounts to almost like 180 million incidences of healthcare associated infections every year. And also, unfortunately, there are also about 16 million deaths which are estimated due to the healthcare associated infections, where the prime driver is the lack of compliance with hand hygiene procedures. It is also estimated that approximately about 65% or 2/3 of infections with antibiotic resistance bacteria are associated with healthcare. That is the care we are assuming we are providing in order to elevate the people from the risks, but at the same time, we are being part of that risk. With the rise of all the modern hospitals equipped with mechanical ventilation, as we know that in the last 40 years, even in India and other global south countries, the number of healthcare institutions which are built are becoming, the vertical buildings with poor natural ventilation. And also, the increase in number of beds year by year, even in India, there is and also the sharp growth in invasive and non-invasive procedures, we can certainly anticipate a further worsening of HAI rates and treatment failures related to antimicrobial resistance if we are not going to act urgently on this issue of compliance with the hand hygiene rates. Moreover, let us not forget that 50% of healthcare facilities, especially in the developing world, are lacking clean water, where the burden of HIs and AMR is significantly higher than those countries which are so-called resource-rich countries. Even during COVID-19 pandemic, when we reached ideal levels of hand hygiene in healthcare settings, compliance rates, even in best of the hospitals worldwide, never crossed 60 to 70%. That is the recent study which has been published. With the diminishing threat perception of the pandemic, which was declared as closed or ended, we are again witnessing a slip in compliance rates, reaching or going back to the pre-pandemic levels, which alarms me and which alarms all the people who are concerned with the infection prevention and control. That's why supporting global and local efforts, including Hand Hygiene Day, is very, very, very important. The theme for the 2024 Hand Hygiene Day, promoting knowledge and capacity building of healthcare workers through innovative and impactful training and education on infection prevention and controlling, including hand hygiene, is very apt and also very important. Let's consider a few facts to better appreciate the role of infection prevention and control and hand hygiene in stopping the spread of harmful germs in healthcare, and also to better understand the objectives of World Hand Hygiene Day 2024. So I am just going to quote what has been mentioned as the objectives for the year by World Hand on this occasion. We just need to know these few facts in order to better understand and also better intervene with some of those aspects which are required. We all know that IPC interventions reduce HIIs and AMR anything between 35 to 70%, and we also know that it is a cost-saving measure. And preventing infection and its spread certainly reduces the human suffering, loss of lives, and produces a lot of economic advantages. High quality wash, effective IPC programs based on the World Health Organization core components, including hand hygiene action, can reduce HIIs by up to 70%. It is established that hand hygiene saves millions of lives when performed at the right times in healthcare. And let me bring this very small aspect again, which is documented by several studies, that the investment into IPC, a 1 rupee investment in IPC and hand hygiene definitely brings in 25x returns. That is 25 rupees we will be able to save if we are able to invest 1 rupee into the IPC, right? It is proven. And there cannot be any arguments here when the people say that IPC is an expense. It is not an expense. It is the right of the patient on one side, and second side, it is also a huge economic return for the healthcare setting. That's why accelerating hand hygiene action is so crucial, and we all should be working towards that. So coming to that, when we understand that we get plethora of these benefits, right? But why it is not happening? What are the barriers to this simple but yet very powerful intervention? Why? While there are many barriers, probably including infrastructure issues, availability of water, availability of hand rubs, etc., but to my mind, the most significant is the healthcare worker behavior. Unless we are going to change this behavior, I think nothing is going to change. We need to work among the healthcare workers on external motivators such as social, organizational and community, as well as internal motivators, which is internal to us, such as knowledge, attitude, beliefs, and values, in order to improve the practices and the compliance. If I'm sure most of you who are participating in today's session are healthcare workers, and if we all believe that as healthcare workers, our primary responsibility is to do no harm, then our natural action should be to practice hand hygiene routinely. So in order to achieve, now we understand all these barriers. In order to achieve the objectives of WHHT 2024, especially the first objective, which is the strengthening of learning approaches to enable implementation of effective training to empower healthcare workers and also to improve hand hygiene and IPC at point of care, several organizations are doing a phenomenal job. And we at IFCI also had been doing our own humble bit, along with the like-minded organizations. We had been working on IPC knowledge of healthcare workers and career pathways for IPC professionals. In the times to come, we shall also collaborate with QAI, which is an esteemed organization which is committed actually to promote the IPC and also the antimicrobial stewardship and diagnostic stewardship, etc., etc. I would like to mention here this journey of IFCI, QAI, Prasho has already started. That first such collaboration already started with QAI supporting the GSPARC 2022, that is the Global South Conference on Infection Prevention and Control and Antimicrobial Stewardship, which is scheduled to be conducted from October 3rd to 5th this year in Hyderabad. So we look forward to welcome you all. And I would like to thank once again QAI for giving me the opportunity to speak on this platform and share our humble thoughts. Let us collaborate to improve infection control practices, and let us take the responsibility for our patients and ensure that we are going to save their lives. Thank you for your attention.
Thank you so much, sir. Thank you so much for effectively summarizing the burden of HAI and the role of hand hygiene in culminating and in IPC. It was wonderful listening to you, sir. It has immensely added to our understanding. So before moving on to our speakers, I would request all our participants to kindly put on their camera so that we can take a picture of all of you. So I would request each one of you to keep smiling.
Keep smiling is one thing which healthcare providers have lost. So only when you ask us to smile, we smile.
Very right, sir. Very right. Care with a smile. Lost.
So thank you so much, everyone. Thank you so much. And now I would be requesting our first speaker, who is Mr. Anirudh Bruman, PhD in nursing, Texila University, Mauritius. He has an MPH. He's an infection preventionist, international assessor of patient safety standards, IPC, critical care and cath lab nurse in different organizations, including World Health Organization, Doctors Without Borders, Saudi Oil Company, UAE Oil Company, and Iran Ministry of Health. He's certified as an IPC specialist, ATCN, ACLS, and PALS provider. Sir, I would request you to kindly start the deliberation and welcome to this webinar.
Good afternoon. Thank you so much for providing this opportunity to talk about the hand hygiene compliance. And I'm very glad that I'm going to share some experience and some technical details about the hand hygiene compliance in the next few minutes. So is it possible that I will share my screen?
Yes, sir, you can share your screen.
Okay. I think you can see now the screen. Am I right?
Yes, sir, we can see.
Okay. So I was asked to discuss about the hand hygiene compliance, which during the patient safety assessment, IPC assessment, it was one of the topics that sometimes we have misunderstanding about the hand hygiene compliance, especially I can see this one during the patient safety assessment. So it is really good to have a few minutes to talk about the hand hygiene compliance. So we are hearing a lot of technical words regarding the hand hygiene compliance, including opportunity. So indication, what is the difference between the opportunity and indication? Sometimes we are receiving the hand hygiene compliance rates reporting like 100%, 90%, and we want to understand, is it possible to have 100%? Is it a dream to have 100% hand hygiene compliance, but really it is possible to have 100% hand hygiene compliance or not. So the opportunity is, sorry. The opportunity is when we are talking about the hand hygiene compliance, opportunity is the moment that we are doing the action. So the observation results, hand hygiene observation result, helps us to determine the hand hygiene practice in the healthcare facility, the training, the education needs for the healthcare workers. So in our measurement observation, opportunities is goes to the denominator in our calculation. So there are different observation methods for hand hygiene compliance, direct method and indirect method. In direct methods, we are doing the observation through an observer. Sometimes patient doing the observation for us, and also through the healthcare workers self-reporting system. And in direct methods, we are using the consumption of the products like hand rubs and automated monitoring system for the hand hygiene sinks and hand rub dispensers. But which one is the best one? Which one is the most reliable one? So the direct observation, the gold standard. So the practice that we are normally doing is the gold standards. You can find the details about the how to do that one, which form you need to use for this hand compliance observation. You can find in the WHO technical manual for hand hygiene. So indirect monitoring, which mainly we are using the hand rub consumption. So sometimes when I'm doing the assessment for the patient safety or IPC assessment, when I'm receiving the reports like 90%, you know, in the world, we barely reach to the 70% in the developed country. Based on the WHO reports, it's varied from 9% to 70%, but very bad that we reach to the 70%. So when you are mixing the indirect method with the direct method, you can reach a more clear picture. I'm going to explain how we are going to do this one, because it's really important as a healthcare worker, as a manager. When you are receiving reports for the hand hygiene observation, you need to compare that one with the consumption of the hand rub in your facility. So normally we are considering 3 to 5 ml of alcohol-based hand rub as a one hand hygiene action. So in the indirect monitoring of hand hygiene, how we are going to calculate the opportunities, because in the direct observation, we can see the opportunities, but in the indirect, we can't see. So there are a lot of study in the world. It's starting just as an average, 8 hand hygiene opportunity per hour per patient care in the pediatric, and the maximum one, 22 per hour per patient in the intensive care unit. What does it mean? If a nurse, just he or she, will take care of one patient in ICU during the 8 hours duty, he needs to do almost 200 hand hygiene. So if we will report 100% for ICU, meaning per nurse, per 8-hour duty, we need to have a consumption of 400 ml hand rub, which is going to be almost 1.2 liter per day, and it's going to be 36 liter per nurse, per patient, in the intensive care unit. So this is really good to have this, you will mix these two together to reach to an understanding about the hand hygiene practice in your facility. And many times we are mixing the indication and opportunity. So what is the difference between the indication and opportunity? We may have more than one indication, and then for 2 indications, we are going to have 1 opportunity, but we are going to have only 1 action. How it's possible to have 2 indications, 1 opportunity? If you are taking care of the patient A and B, which they are in the same room, after you are taking the blood pressure from the patient A, you want to move to the patient B. So the indication for patient A is after touching the patient, because you touch the patient and you want to move now to the patient B, but without any interruption, without any other activity. So for the patient number A is after touching the patient, but for the patient B is before touching the patient. So you have 2 indications, but 1 opportunity. And this is the main misunderstanding of the hand hygiene compliance measurement, because sometimes people, they are counting 2 indications and they are expecting to have 2 action. While if these 2 indications overlaps together, we have only 1 action. So there are a bias during the hand hygiene observation. One of them, which is very common, and I think Dr. Rana knows more than anyone, is about the observation bias. Sometimes when we are doing this one, people, they know we are going there to do the hand hygiene observation. So they are doing the better hand hygiene. So which is okay. We don't want to work as like detective. We don't want to do the covert observation, because this is bringing mistrust among the healthcare workers. And if you will do this one frequently, the hand hygiene observation, so it is like the Hawthorne effect, and is going to improve the culture of the hand hygiene. So in the starting implementation, the beginning of the implementation of the hand hygiene compliance observation, we are expecting the high rate, because the people, they are doing hand hygiene better because of you. But if you will continue this one for after 2-3 months, you are going to reach to the real hand hygiene compliance rate. So this, we call this one the observation bias. The other one related to the observer. Sometimes it's, again, it's a very common bias. We are acting based on our experience, not based on the standards. How you will recognize this one? If two observers, they will do the hand hygiene in the same facility, they are going to get very different results because they are not observing based on the standards. They are observing based on their experience. So for this one, we need to train observer, a validated observer to prevent this one. And the last one is the selection bias. Sometimes we are doing this compliance assessment only morning between 8 to 9 o'clock. We are focusing only on nurses, not the doctors, not the others based on the WHO recommendation. So the result you are receiving is the selection bias. You focus on a specific department. You focus on a specific healthcare workers. Maybe at 8 o'clock when you are entering a department, like you are observing a specific healthcare workers. So this is called the selection bias. So you can remove this bias by randomly closing the locations, times, and the healthcare workers. And then this is the question always comes. How many observations we need? What is the length of the observation time? So the number of observation based on the WHO recommendation, it's 200 opportunity per observation unit. So if you want to compare the hand hygiene compliance between the pediatric and ICU within the 1 year, during the 1 year, you need to have 200 observation for the pediatric, 200 observation for the ICU in order to compare them. If you want to compare between the professional categories, you need to have 200 for example, nurses, 200 for the doctors within 1 year. Just 1 year is just the example between the, but it should be minimum 1 year. So the length of observation should be at least minimum. You can increase that one up to 10 minutes more, it's 30 minutes, but usually we are not recommending to decrease it. You can make it in 10 minutes, but the standard of the one session assessment inside the pediatric department is 20 minutes. Inside the intensive care unit is 20 minutes, but you can increase that one for up to 30 minutes. And if you are a very, very professional hand hygiene observer, you can observe only 3 healthcare workers together. It's impossible that you will do more than 3. Remember, in the hand hygiene observation, we are observing the actions. Maybe we don't have time or opportunity to observe the technique of observation. Normally, the technique of observation is going to be evaluated, assessed during the researches. But for hand hygiene compliance, what we are monitoring is the action, not the technique. And there is a very important, also the last sentence maybe from my side, very important, we think that in the ICU, normally we should have better hand hygiene compliance rate. While the studies show if you will go to the department with the number of the opportunity is less, so you are going to face with the better hand hygiene compliance. So always when we are talking about the intensive care unit, the hand hygiene compliance in the departments that they have more opportunity is less than the other departments. And there are a lot of other ways to compare the quality of the hand hygiene compliance. During the COVID-19 pandemic, we reached to almost 100% compliance after touching the patient, but we never did reach to, before touching the patient, more than 50%. because before touching the patient is only harmful for the patient, not for us, unfortunately. I like this picture. This is my holy picture we took during the epidemic of Ebola in the Liberia. I went to a village and I observed in the village every like 10, 20 meters, they established a hand hygiene station with almost nothing. So they used this Coca-Cola can to collect the rain water. They put they prevented the bar soap from being wet by the rain, and they established in their village several hand washing station just with a simple action. And thank you so much for your attention.
Thank you so much, sir. Thank you, sir, for elaborating precisely on the methods of monitoring hand hygiene compliance, both direct and indirect. I think this will definitely help the healthcare workers for effective audit as well as compliance.
Thank you.
So I would request the audience, if at all they have any questions, they can drop it in the chat box. And if time permits, we will be taking it at the end of the session. Our next speaker for today is Dr. Aditi Jindal, who is presently working as senior consultant and head biochemistry at Rajiv Gandhi Cancer Hospital and Research Center, Delhi. Over 15 years of experience in medical field with extensive experience in diagnostic labs, training and mentoring MBBS, BDS, and medical technology students, quality assurance, and project management. Ma'am, over to you. You may kindly start your presentation.
Yeah, thank you so much, Dr. Saroj. And thank you so much, Rehma and Dr. Rana sir, for giving me this opportunity. And I was quite impressed with Dr. Ranga Reddy sir talk on the compliance of the hand hygiene, especially in the healthcare workers. And I would say that yes, hand hygiene is something that we all health workers are aware of, but there is some sort of resistance to do the hand hygiene in the real practice in our healthcare settings. So this is the place where I work, and I would say this is the life of all the healthcare workers. Here, the one thing that is missing is the patient, around which the life of every healthcare worker revolves. And we are dealing with so many infectious things like samples, blood, our equipments, the devices that we are using in our healthcare. In from the laboratory side, we have microscope, pipettes, apron. So I think it is a life of every healthcare worker, with patient being the centralized focus. Now, this is what such a beautiful nails. I would say that all the females who are listening to this presentation would agree with me. Yes, we all like to keep these sorts of nails, right? And so, what do you think? What do you think, everyone? Yeah, so this sort of nails, is it important, or is it a fashion statement like the healthcare worker should follow? And why having clean hands is important in the healthcare? And why are the hands are the main source where the germs spread in the environment? So, according to a research, it says that when we have our artificial nails, it is the hospital personnel who is having the artificial nails possesses more pathogens before and after hand hygiene in comparison to the person or the healthcare worker having natural. So I'm sorry to all our female healthcare worker. Yes, your nail should be natural and it should be less than 1/4 inch. So this is the main important thing that as a healthcare worker, we should be monitoring. And the same thing, the COVID pandemic has taught us the importance of the hand hygiene. As the previous speaker has already explained about this thing, that hand hygiene was extremely important during the COVID period. And we all, as a healthcare worker, has realized its importance during this period. And there were various initiatives by government, Ministry of Health and Family Welfare in India and across all the global platforms, where the patients, the healthcare worker, in fact, even the normal household were following the hand hygiene practice. You could see an elderly patient in the home following the hand hygiene practice. So, what is hand hygiene? Hand hygiene means cleaning your hands either by using hand washing with soap and water, antiseptic hand wash, antiseptic hand rub, or surgical hand antisepsis. So, the germs spreads from the various surfaces. Even when a healthcare worker is touching a bed rail, even the healthcare worker is removing the mask, the germs can spread. So, what do we want to learn? There are a lot of items that a healthcare worker touch. So according to CDC, a nursing staff touch up to 15 different surfaces during a single patient interaction. For a nurse who is having on an average 12-hour duty, will touch about 912 surfaces. So hand hygiene is very important because it's easier for the germs to grow between the fingers, between the fingernails, and the breaks in the skin. And in such a scenario, it is very important for us to notice, to observe, as the previous speaker has already told about the various compliance monitoring strategies. So one of the strategy is to monitor this, to see if our colleague or if our supervisor or another healthcare worker is following the healthcare practice or not. So what we need to do, what can be the effective strategy, is that we can talk to our colleagues more about hand hygiene compliance, and we can also at the same time educate our patients on how hand hygiene is important and evaluate, are we ready to take this risk with increasing so much burden on the healthcare? So what is the best evaluation technique? We all know about AI, we all know about Chat GPT, we all know about so many devices which have come into the market. But still, the best evaluation technique is the self-evaluation, self-reflection. So I would like to ask all of you, how many times do you actually wash your hands during an average workday? So studies have shown that healthcare providers practice hand hygiene less than half of the time, that is 50%, and as many as time they need to clean their hands. And this is and it also depends upon the number of patient and the intensity of care. So we need to have more personal reflection. We need to keep ourselves understand that why hand hygiene is so important, and we can always do the self appreciation also. I think self appreciation is the best motivation. So through that only we can practice good hand hygiene practices. There are many modern tools available. We have different methods of auditing. We have automated hand hygiene monitors which are available. We have a computer vision technology. There are a lot of wearable devices which will monitor your hand hygiene compliance. There are mobile apps which are available like Speedy Audit, iScrub. Many tools are available. With those so many modern tools available in the market, we have many resources which are available on the CDC website, many tools that are available that we can use to monitor the hand hygiene compliance. But I would say that technology has changed, but the biology has not changed. So please follow the hand hygiene. Healthcare augmented with AI is the future. Artificial intelligence, machine learning, data analytics will be a part of healthcare, but no one will do the hand hygiene. Hand hygiene has to be done by the healthcare worker, and at the same time, the hand hygiene has to be educated to our patients as well. So we have wasted few billions of money by playing rock, paper, scissors in monitoring our healthcare compliance. I think we all should, like this platform like QI has given us, we should try to make more and more like these training programs available to the healthcare workers so that the burden on the healthcare is reduced. So before you ask me the questions, I will ask the questions. So, what is the single most important reason for the healthcare worker to practice good hygiene? That is to prevent infections that the patients acquire in the hospital. Use of artificial nails by healthcare workers poses no risk to the patient. No, it poses a risk to the patient. So we need to have nails which is less than 1/4 inch. How often do you clean your hands after touching patient's intact skin? Suppose you are monitoring blood pressure or you are taking the pulse of the patient. Always. This, I think every person should do the self evaluation and answer how often do you clean your hands after touching a patient or a contaminated surface in the hospital. How many times do you observe your coworker after touching a hand, after touching a patient or a contaminated surface? Do they follow the hand hygiene? I think these two questions has to be done as a self-evaluation, right? How much time would an ICU nurse save during an 8-hour shift by using by using a alcohol-based hand rub instead of soap and water? That is 1 hour. This is based on the 12 opportunities per hour for 8 hours with a hand washing time. And that also includes like walking to the sink and coming back. So it is very essential that an alcohol-based hand rub is provided at the patient's bedside so that the healthcare worker will no longer need to walk to the sink and wash the hands. So a co-worker who examines a patient with vancomycin-resistant enterococcus borrows my pen without cleaning his or her hand is likely to contaminate my hand by VRE? Yes, strongly agree. How often do you clean your hands after touching environmental surface near a patient? Always we have to clean our hands. With this, I would like to say that I have my hand hygiene, I have my alcohol rub near me, and I think everyone should have this. Thank you so much.
Thank you, Dr. Aditi ma'am. It's true that we have to lead by example, and personal reflection is crucial in this regard. Thank you for highlighting the same. Now, I would request our next speaker, Dr. Anubhav Pandey. He is presently working as head clinical labs at Amrita Hospitals, Faridabad, Delhi NCR. He is a highly accomplished clinical microbiologist and clinical laboratory professional with more than 19 years of experience post MD. Dr. Anubhav is a lead auditor for ISO 9001 and CAP, internal auditor for ISO 15189 and NABH assessor. He has worked in the organizations of repute at senior profiles. Dr. Anubhav, you may kindly start the presentation. We welcome you to this webinar.
Yeah, thank you. Is my screen visible to all?
Yes, it is visible.
Yeah, good afternoon all. And I believe most of the things have been already said by the fellow speakers. So I would like to slightly emphasize on the fact that we know all about everything about the benefits of hand hygiene. We also know what exactly the patient outcome would be if we practice hand hygiene on a regular basis. We all know what are the quality indicators. We know almost everything. Like this is one of the subjects which has been most studied and most talked upon, and most, I believe, the maximum trainings in any hospital setting happens is on the hand hygiene. But despite the fact that why we are not able to overcome these challenges, and it is not becoming a very much of a reflex action or a natural action that, okay, fine, this is done and dusted case, and everybody knows whosoever comes from any hospital, any amount of experience, but still these challenges are there, and we look at percentages which are quite difficult to justify the fact that we are still in the era that we talk about how to improve the hand hygiene and how to make it. So I would just give a brief overview, which we all know, just to, and these are where are the opportunities and why, and still they become a lacuna point for us, and how we can, if, and by end of the presentation, I would be able to highlight few facts that how can we actually overcome these challenges which we face in any of the health settings we are working with. So what are the questions? It's all about like what is hand hygiene? We know who need to do, why, where, when, how. These are all pertinent starting points that we are more or less aware, but still we are not able to comply with it. So we all know the bacterial count all across the various sites, like we are loaded with bacteria, and naturally there will be a significant amount on the hands which are like transmitted to the patients, and we are responsible as a healthcare worker, be it a nurse, be it a doctor, who ends up doing all this. Then these are the bacteria and fungi or other pathogens which we know which can be transmitted to all through this. So I will not like to name all these bacteria. And we are facing day-to-day problems with these, and infection control teams are trying to figure out. So what is actually hand hygiene? It includes a routine hand hygiene, which we all know, and then antiseptic hand hygiene and the surgical hand hygiene. So routine hand hygiene is like what is shown in the picture is that once you touch the patient, you do any process and procedure. Before and after that, you need to do a proper hand wash. And antiseptic is like you had alcohol rub. If you don't have access to the water and soap, then you can utilize this. So the current scenario, what happens is it is like almost 15% of patients in developing countries, and antimicrobial resistance leads to 7 lakh deaths. One model estimated that increase of 1% in hand hygiene. Just noted down that only just 1% of increase in hand hygiene compliance would nearly save $40,000 in MRSA related healthcare costs per year in a hospital setting. So improved hand hygiene has been shown to reduce HCI spread by 40%, and full compliance can reduce the risk of acquiring MRSA. So this is one of these studies which highlights that even a percentage of improvement across the hospital can save millions of money which is invested in ICU settings or the complications we are handling. So on an average, 61% of healthcare workers in some facilities up to 90% do not adhere to best hand washing practices. So this is the reality, and may not be the only hospital, or among all the hospitals which you see, we are hardly able to reach 60 to 70% on the rigorous follow-up. A study of healthcare facilities in 54 countries found that 35% failed to offer soap and water. That is also another area of concern, that management support is not there, that this is a costly measure. We will continue to, you manage yourself. And you maybe alcohol rub is good enough, or something or the other excuse comes on supply chain break is there. That is also one of the reason for poor compliance in the hand hygiene. Several studies have shown that hand hygiene compliance, in particular among general practitioners and doctors working in pediatrics, dermat, and dialysis, is well below 50%. So that I will speak in the next slide, that where the healthcare workers, and it is the most commonly the clinical side of the or the doctors who are the least compliant when it is compared with the other healthcare workers. So risk factors for poor adherence to hand hygiene. What are being observed and what are being notified? This is a WHO sheet, which is the essence of this presentation. If you look at the observed doctor status, so doctor feels that my hands are immune, and I have a godly status that my hands will never spread an infection. That could be the reason that nurse should do a proper hand hygiene, GDA should do a proper hand hygiene, or anyone else who is visiting, even the attendant should do a proper hand hygiene rather than me myself. So nursing assistant status rather than a nurse. So I am assisting, why should I need a hand hygiene? I'm just holding a file. Then male sex, obviously males are making more defaults. Then working in an intensive care, we always feel that we are overwhelmed with patients. There are a lot of critical noise in surgical units and emergency care. So there is a common excuse mechanism that we tend to forget. Then working during week versus weekend. So the weekend is always like nobody is there, no management is there, no senior doctors are there. So this is a relaxed day. You can have like In schools, it's being celebrated as a junk food day. So today it is hand hygiene is not required. Then wearing gowns, oblique gloves before and after contact with patient environment. So we know the touch points, we know the opportunities, but still we are not able to follow it up. Caring of patient aged less than 65 years. That is also another area of concern. Like younger the patient, we are less compliant with them. Caring of patients recovering from clean or clean contaminated surgery in post-anesthesia care unit. Patient care in non-isolation. Isolation, we are very alert. Okay, fine, this is a patient is infected. So we try to protect ourselves. That's why we do again and again hand hygiene like we did in COVID. But when it comes to care of others and in a normal ward setting, we tend to forget. Less than 2 minutes of patient contact, it hardly matters. Why is to do an hand hygiene? For just we have just briefly touched or briefly moved around. Interruption in patient care activities. Understaffing is one of the reasons, and the longer shift. That also takes toll on the hand hygiene practices. Now, self-reported risk factors here, where the patient, where the person who is performing an hand hygiene and that has been witnessed across the board. It could be because of the attitude problem. It could be because of the lack of the support from the system, or there are certain other issues like hand washing agents may cause irritation and dryness. So they might have been reported, but the product would have not been replaced. Then could be shortage or inconvenient sinks. That has also be there. Then lack of soap and towel, we discussed that 35% one of the hospital didn't provide that utilities for that. Too busy, that is the major reason everybody says, I'm very busy, I cannot do this. Patient needs take priority over the hand hygiene despite it is for the patient. Low risk of acquiring infection from patients, because obviously I will not acquire the infection. It is an immunocompromised state. I am not immunocompromised. My status is fine. So why to do it? Wearing of gloves, believe that use obligates the need of hand hygiene. This is a very common problem, that after taking off the gloves, we don't feel the need of doing a hand hygiene. There could be training, knowledge issues, experience issues, educational, that I believe most of the hospitals, most of the healthcare providers are trying to sort it out. Then in the previous presentation also mentioned the lack of role model, that we need to first define ourselves, that what we are doing, how many times we are doing. So then it automatically starts percolating among the colleagues and the superiors. Forgetfulness is the best answer to say, okay, fine, I just missed out. Skepticism on hand hygiene, whether to do, not to do. So these are the possible risk factors or possible observations being done, compiled to say these are the areas and these are the pointers wherein the hand hygiene compliance starts getting down. So this we know by virtue of the fact that how the organism travels. Even if you move around the bed, touch the trolley, you can see these dotted pictures, which clearly mention that these are like organism laden areas, and we just hold the hand of the patient, check the pulse, and move on. And in the meantime, we have carried certain amount of bugs that we just further. Then healthcare worker just hands, then it is like you holding, then you haven't done the hand hygiene practice, you haven't washed or used the alcohol rub. Next patient, you move with a better amount of flora. Defective hand washing, that has been discussed, that the steps of hand washing, which we keep on monitoring as well. And then A to B, how it transmits. So there are 5 moments we all know, but these are the opportunities at the same time, the forgetfulness and the carelessness on our part that we need to identify, and we need to be voluntarily practice for these things. So coming to the other fact that I will skip these slides, then frequently missed areas we know. So we need to be very sure that the dorsal side has to be taken care. So the use of gloves do not replace the need of hand hygiene. So what is the solution of all these? How we can increase the compliance? How can we make better environment and ecosystem where the hand hygiene compliance can reach up to 100%? That's what we aim for. So first, data we all compile, but it is left for the audit or the NABH kind of a perspective, rather than it is presented in a cohort, in a group of people where It is not very complicated, understandable to the grassroots level worker as well, the staff, the nursing staff, that what actually the data means and where we stand today. And there should be some incentives around it, that if we improve, that will happen. The unit competitions can be created, best unit who practices the hand hygiene. Then there could be an audit and feedback. We do audits, we find the problems, we present it to management, but we never go to the downstream and try to discuss with them and give them a positive or a constructive feedback. Sharing of experience, that what worked well for me can work for you as well. That's how the people also get inspired. And naturally, you need to keep on improvising, thinking out of the box, that what new can be done, how we can engage people and can raise an interest that hand hygiene with compliance get better and better. Involving younger colleagues in spreading the message, who will be more enthusiastic about certain practices. Visual cues can be displayed. There could be a video wall, there could be a running matter, there could be posters, and large enough that everybody should acknowledge. Somebody does good, that's what the reward, that the appreciation and acknowledging should be in public, should be in form of a certificate or something like that. And the patient advocates. What does not work is the punitive actions. It will be like, okay, fine, this unit will be punished, this is not doing. It could be a very temporary effect, but everybody gets immune to it practically and say, okay, fine, you punish again, we will continue the same. Lectures don't work. Calling 150 people, giving a good lecture on a talk, everybody learns, understood, attendance taken. It's more of an on-site, on-ground demonstration would help. Resources are inadequate, then obviously you cannot ask. Absence of a role model, you need to create role models, and creating a role model and rewarding that role model also is equally important. Then others will like to strive for it. And if there is no administrative will, meaning by it, all approaches come from top down rather than bottom up. So the management, the top management or the administration has to be supportive, and the blaming and shaming, it looks apparent, it works, but it actually creates negativity, and the people start digressing from the actual path they want to follow rather than supporting us. So eventually they will have much more poor performance. It is like rejecting them. So better to not to reject rather than uplift them, try to teach them, try to educate more, try to support, and naturally try to appreciate if they improve from there on. So that's the way we can empower, and thanks for organizing these sessions. Thank you.
Thank you, Dr. Anubhav. Very rightly said that we have to take the responsibility for making hand hygiene practices more engaging, because the data shows that it's not always the resource constraint that leads to poor compliance, but it's the attitude. Thank you so much for this wonderful presentation. I hope this have been an enriching and fulfilling experience for all of you. Now I would request our chief guest, Sri R. Govind Hari sir, to kindly enlighten us with his wisdom. So we are eagerly waiting to hear from you.
And the wisdom lies within that. Anyway, thank you. Ladies and speakers, participants. Before I begin, I wish to say, learned a lot listening to remarkable speakers on today's subject matter. My salute, great honor to address you all on this significant occasion of World Hygiene Day. Today, as we gather to commemorate the importance of hand hygiene, we are definitely reminded of the profound impact that a simple act like washing our hands can have on preventing severe and even fatal infections. I would like to draw a parallel to the power of compounding and hand hygiene.
Sir, your voice is breaking, sir.
just as financial investments grow through the power of compounding, so too does the impact of practicing good hand hygiene. The simple act of washing can exponentially decrease the spread of harmful pathogens and save countless lives.
So your voice is lost. I think he's disconnected. I think his internet is troubling. Let him join.
Are you able to hear?
Yes, now we can hear you, sir.
Hello? Hello?
Hello.
Okay, thank you. When such a high technology can fail sometimes, so this hand washing is something which is very important. Anyway, can I continue?
Yes, please, sir.
Yes,
Please.
sir.
Okay. So healthcare professionals per se, in particular, understand the critical importance of hand hygiene in their line of work, where they constantly interact with patients and come into contact with various surfaces, as spoken by the earlier speakers. The risk of transmitting infections is significantly heightened. By adhering to strict hand hygiene protocols, healthcare workers not only protect themselves, but also prevent the spread of infections within the healthcare facilities, ultimately safeguarding the health of their patients as well as the broader community. However, the significance of hand hygiene extends far beyond the walls of hospitals and clinics. In our daily lives, whether at home, at work, or in public spaces, practicing good hand hygiene is essential to prevent the transmission of the disease. From preventing common colds to more serious illness like influenza, etc., and even antibiotic resistant infections, I feel the impact of hand hygiene cannot be overstated. Moreover, the ongoing global COVID-19 pandemic has underscored the critical importance of hand hygiene like never before. As we continue to navigate these challenges, washing our hands frequently remains one of the most effective measures to prevent the spread of the virus and protect ourselves and, of course, all around us. As we reflect on let us remember that every time our own health, but also contributing to a collective effort to promote public health and well-being. The impact of this simple yet powerful measure is profound and far-reaching, demonstrating the transformative potential of small actions when compounded over a period of time. In conclusion, let us all together reaffirm our commitment to promoting hand hygiene as a cornerstone of infection prevention and control. Together, let us harness the power of compounding to create a healthier, safe world for generations to come. I thank all of you, especially Ranaji and his team, to have invited me as the chief guest. And I'm sure I could drive, in my simple words, a non-clinician, being a non-clinician, effective words to ensure that, to sum up, we need to be constantly reminded of hand hygiene. Thank you very much.
Thank you, sir. Thank you very much.
Thank you so much, sir, for simplifying the entire concept that we have discussed in the entire session today. Now it's time to break the suspense, actually. Everyone is waiting to hear the winners for the WHHD contest that we organized. So without delaying further, I would request our special guest, Dr. Ranga Reddy Buri, sir, to kindly announce the consolation prizes. And I would request my colleague Rema to kindly share the presentation.
Thank you very much, Dr. Saroj. I think we are coming to the most interesting part, looks like. Now, always announcing the winners.
वीडियो और पोस्टर मेकिंग कंपटीशन है
Okay. So, ladies and gentlemen, as we celebrate World Hand Hygiene Day 2024, it is my honor to acknowledge the commendable efforts of our consolation prize winners in the QAI competition for hand hygiene practices. I hope I spelled it right. That this is a QAI competition for hand hygiene.
Yes, sir.
Yes, sir.
So their dedication and commitment to this cause have truly made a difference. All these winners, both consolation and also first, second, and third. Firstly, we have Moina Das from Marwari Hospital, Guwahati. Your contribution has been invaluable, and certainly we thank you for your efforts. Ms. Moina, it is you. Next, we have Suman Podar from Institute of Neuroscience, Kolkata. Of course, all the dedication to hand hygiene never gets unnoticed. And today, we appreciate your hard work. Finally, we have the team of Dr. Vandana Bhasin, Dr. Shruti Agarwal, and Kunika Bhattacharya from Kite Senior Care, Bangalore. Certainly, your collective efforts have made a significant impact on this initiative. So now, I was told to invite each of you to share a few words of thanks and perhaps some insights from your journey in this competition. Because sometimes what happens is success stories, they get proliferated very easily, which has very less impact on, what we can learn. But when you share your journey, when your downfalls and, misfits, etc., they are going to significantly contribute actually to learn a lot on what not to do. So now we would look forward to hear from you. Let's start with Moina Das. Madam, the stage is yours. Please go ahead.
Anybody, Moina Das, can you kindly unmute yourself and say a few words? Or anybody from her team, if she's not there?
Then we can move to the next one.
Yeah, we can move to next. Next is Suman Poddar. If you are there, kindly unmute yourself and say a few words. Okay, all right. It's a voluntary process. If not willing, then maybe we can move ahead. Then we move to Dr. Vandana Bhasin and her team. If you all are there, kindly unmute yourself and say a few words.
Yes, this is Dr. Vandana from Kite Senior Care. I wish to thank my management at Kites for encouraging us to take part in the competition. I would really want to thank QAI for giving us this opportunity and for giving the prize. And last but not the least, I wish to really thank my team members who have, conceptualized, designed this wonderful poster. Thank you so much. And I would like to dedicate this award to my dad, who used to keep telling me while waking me up that your life is in your hands. So that is what
Hello.
inspired us to conceptualize this poster. Thank you very much to the entire leadership team of QAI and for our management at Kite Senior Care. Thank you so much, everybody.
Thank you. Congratulations and thank you to all the winners of this context. Even consolation prize is winning, I would say, because they have tried and they have achieved something and they are recognized. So they should feel really proud and happy for their achievement. Now we would be moving towards. Thank you, Ranga Reddy sir, for the announcement. So now we would be moving forward for the announcement of the winners of dance competition. So for this, I would request Sir R. Govind Hari to kindly announce the winners.
Yeah, I'm extremely delighted to announce the winners of QAI competition. Though I cannot bring the real fire in announcing the winners like Amitabh Bachchan in Kaun Banega Crorepati, but however, he brings such a big hype that the winners will feel terribly excited. But I am very excited and delighted to announce Pushpagiri Medical College Hospital, Tiruvalla, Kerala. And the second prize goes to Bengal. And lastly, the first prize goes to Apollo Specialty Hospitals, Vanagaram, Chennai, Tamil Nadu. I congratulate all of you. And if you are in the Zoom call now, I invite you to say a few words on your achievement. First, the last will be the first. Let the third prize winner can speak.
Sir, if I think we would like to play the videos of these winners before they speak something. So I would request Rema to kindly play the videos of the winners.
Yes, sure. Yeah.
We'll be starting from third. Yeah.
सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखात्महे सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखात्महे
So very well put together in classical form. Team Pushpagiri Medical College. Anybody would like to say something? Yes, please.
On behalf of Pushpagiri Medical College Hospital, I want to express our sincere gratitude to the QA and the CEO, Dr. Rana sir, for giving us this incredible opportunity to participate in this competition as well as webinar. Thank you so much. We have adopted this Shanti Mantra from Britadaraniya Upanishad, that is Sarve Bhavantu Sukhinaha, that is, may all be happy, and Sarve Sandhu Niramaya, may all be free from illness, and Sarve Dridrani Pashyantu, may all see what is auspicious, Na Kachit Dukkapad Bhave, may no one suffer. That is the meaning of this mantra. Thank you so much.
Yes, ma'am, very well put together. Thank you and congratulations to you and your team. Now, I would request Rema to kindly share the video of the second prize winner.
बड़ी तेरे इश्क में जब से करे किसी काम की जालिम बड़ी कोई फिक्र मुझको किसी अंजाम की जालिम गिनूं सांसें जपूं माला मैं बस तेरे नाम की जालिम बड़ी तेरे इश्क में जब से करे किसी काम की जालिम
So it was really entertaining. Anybody from the team to say a few words regarding this creations and the creativity that they have showcased?
Joseph from Siliguri Get Alliance SBI Hospital. I'm working here as an operation manager and training head. So it's like I just want to thank all of the team member of QI for selecting the video. And truly speaking, before making the video, you don't have goal to target to get the prize actually to win the award. But our goal is to we have lot of fun activities. We conduct a lot of fun activities in a hospital to make our staff things to learn very easily. Because it's very difficult to teach every adult staff to you have to follow this, you have to follow this. It's very difficult. And our HR department also very much aligned to arrange a lot of fun game, which is very easy to remember. That was our goal, to make things very easy for our staff to things to learn. And as we're a training institute also, we have a lot of students. So to encourage our student also, we make most of the video by our student. So it's a fun and fun-based activity learn also. So thanks a lot. Thanks a lot. Thank you very much.
Congratulations and thank you. Thank you so much. Now I would request Rema to kindly share the video of the first winner. Congratulations, Team Apollo Vanagram. I would request one of your team member to kindly say a few words on this achievement.
Hi, ma'am.
Hello.
This is Deepa from Quality Department. We have uploaded this video, and first time we were participating in QAI, and very happy to achieve this first prize for this video. And this will be encouraging our staff to do more activities, and it will be an encouraging program too. Thank you.
Congratulations and thank you. Thank you for showing that the contribution of every department is essential to achieve this infection prevention and compliance to hand hygiene practices. So now we come to the end of today's webinar, but before that, I would request Rema to kindly share the flyer of our upcoming infection control training that we would be conducting. Just a glimpse of that.
Move to the
So
next
this is our
agenda point,
infection
please.
prevention and control training for hospitals and clinics that is scheduled on 28th and 29th June. So I would request all the participants who has joined for this webinar and the contest may kindly join this training as well. We would be sharing this to all in via mail and also on WhatsApp. So I would request Rema to kindly put up the screen share for this. So I hope it was a wonderful session for all of us because everybody has contributed to make this a grand success because we have seen how different people from different organizations across the country have participated to make this event successful and also to make hand hygiene more engaging. This is what is the need of time because we have to make it engaging to be more compliant to this. As we have seen in different from different speakers, the data that shows that we can really increase the burden of HAI with little efforts if we comply to this by changing our attitudes. So I would like to give full-hearted thanks to our chief guest, to our special guest, and then to all our speakers, our CEO, then our participants for the webinar, and also team QAI, Sakshi, Rema, and Manish for making this happen. Thank you so much. We will wrap up for today. Thank you.
Thank you, everyone. Thank you, Rangareddy Garu. Thank you, Govind Hari. Thanks, Ani, Aditi, Anubhav, for joining. Thanks all the participants. Thank you. Have a nice day.
Thank you, sir.
You all.
Thank you, ma'am.